Good afternoon. My name is Caitlin, and I would like to welcome you to a very special Activ Doctors Online webinar discussing breast cancer awareness. Did you know that while most people are aware of breast cancer, many do not have a plan to detect the disease in its early stages and to encourage others to do the same? Today's webinar will be discussing how you can take control of your health to prevent breast cancer, the signs and symptoms of breast cancer, as well as the importance of catching breast cancer early. Joining us today is Clinical Assistant Professor from Georgetown University and Activ Doctors Online Medical Director, Dr. Howard Zahalsky. Dr. Zahalsky, welcome.
Thank you very much, Caitlin. Today we're going to talk about breast cancer, and I want everyone to buckle in because we're going to try and go over a lot of information to make you experts on preventing, detecting, and understanding breast cancer in yourself and in the ones you love. So we're going to start with what is breast cancer. So in the typical breast cells are supposed to grow at a certain age. Now, what you can see here on the screen is that breast cancer is a disease in which malignant cancer cells form in the tissue of the breast. The damaged cells can invade the surrounding tissue, but with early detection and treatment, most people continue to lead a normal life. So what does that mean when we say damaged cells? What we're talking about is really genetic damage. As I said, breast cells, and in fact all cells in your body, at one point are growing. When you're a baby and when you're going through puberty, your whole body is growing, and in particular, especially in young women, the breasts are growing. But at some point, you say, we've grown enough. People don't grow to be 15 feet tall. And after a while, even the breasts stop growing. However, if there is a genetic problem in some of these cells as they are growing, sometimes the growth of these cells or an individual cell can get turned back on. And a cell that was supposed to have stopped growing in puberty continues to grow or restarts growing over and over and over again, and that's cancer. There's several types, and with these different types of breast cancer, I want you to think of them as being mature breast cancers versus immature breast cancers. All breast cancers are monstrous, especially if you have one. But I want to give some analogies of different types of monster. A mature breast cancer, if you will, is the equivalent of Count Dracula, a vampire. Looks very much like a human, can act like a human most of the time, but is clearly still an evil creature. The counter to that is the immature breast cancer. The immature breast cancer would be the equivalent of the 70s movie monster, The Blob. Doesn't look anything like a human, doesn't have any direction to it, just kind of oozes outward, and no one would mistake that for anything even remotely resembling a more sophisticated vampire. So here we have some quick facts that are important to know with breast cancer. First, 1 in 8 women will be diagnosed with breast cancer in their lifetime. So this is not an uncommon disease. Breast cancer is the most commonly diagnosed cancer in women. Breast cancer is the second leading cause of death among women. Each year, it is estimated that in the United States, 220,000 women will be diagnosed with breast cancer, and 40,000 of them will die. And although breast cancer in men is rare, an estimated 2,150 men will be diagnosed with breast cancer each year, and approximately 410 of them will die. Without doing the math too much, I can tell you that breast cancer in men tends to be a more aggressive disease, and the chance of dying from breast cancer in a man, it tends to be higher than that in women. So what can we do to prevent breast cancer? The best way to survive breast cancer is to never get it in the first place. So anything we can do to avoid breast cancer in the first place certainly is the first-line treatment in terms of preventing and surviving breast cancer. So what are some of the things that we can do to prevent breast cancer? And it's a 3-part Venn diagram that you have in front of you for cancer prevention, things we can do before we get breast cancer to prevent breast cancer from ever starting. Breast cancer prevention starts with healthy habits such as limiting alcohol and staying physically active. And here's how we can understand what you have to do to prevent your breast cancer risk. You can see the 3 parts of the Venn diagram are physical activity, diet, and weight control, which clearly all overlap with each other to some degree. Now we're going to talk about each of those parts of the diagram in a little bit more detail, starting with diet on the next slide. Look at that, green leafy vegetables, broccoli, carrot, nice healthy foods. You're probably not at all surprised to see that these are good foods for preventing breast cancer as well as a variety of diseases. A diet that's heavy in vegetables and fruits is definitely thought to lower your risk of breast cancer, and eating a diet of healthy fruits and vegetables can lower your risk of other diseases as well, including other types of cancer, diabetes, heart disease, and stroke. One study showed that a high-fat diet during puberty definitely increased the breast cancer risk, and an additional Harvard study found that a diet rich in carotenoids, which is a vitamin found in fruits and vegetables, lowered the risk of breast cancer. So the first step in preventing breast cancer, especially if you're at high risk, is a healthy diet with lots of fruits, lots of vegetables, and avoiding certainly the high-fat foods, especially in women, you're young and your breasts are still maturing and they are more sensitive to the environmental factors that are affecting them. So work it out. Physical activity, besides for helping you maintain a healthy weight, which prevents other diseases, can definitely help in the prevention of breast cancer. The Department of Health and Human Services recommends at least 150 minutes a week of moderate aerobic activity or 75 minutes of vigorous aerobic activity. Regular exercise seems to lower the risk of breast cancer by as much as 10 to 20%. And for postmenopausal women, older women who may be less prone to getting exercise, that effect is even more pronounced. So even as you might be getting older and thinking on cutting back on your exercise because you don't really care as much how you look in the bikini, that's when exercise is really important in terms of preventing breast cancer, and you could have a significant effect on lowering the breast cancer. We're going to talk more about weight, how to maintain a healthy weight. Did you know that fat can help breast cancer grow? Breasts are made up of fatty tissue, and women with dense breasts on mammogram, which when you have dense breasts on mammograms, it's not usually more breast tissue, it's usually more fatty tissue, have a higher risk of breast cancer, and women with denser breasts are at 1.2 to 2 times the risk of an average woman in terms of getting breast cancer. And at least part of this risk may be due to the fact that dense breast tissue makes mammograms less accurate, so we are less able to find early breast cancers, and you're more likely to have more serious advanced breast cancers if you have denser breasts by the time they are diagnosed. Now, why does fat make breast cancers grow more? And as I just said, part of it is not being able to detect the breast cancers early as much. But the main reason is that fat makes estrogen. Normally, in women, estrogen is made by the ovaries. However, fatty tissue in men and women increases your estrogen levels. Estrogen is the food for breast cancer, and we'll get to that in a few minutes. One study found that if you have a 60-pound weight gain from the time you're 18 and you're a woman, you have doubled your risk of postmenopausal breast cancer. That's because when you become postmenopausal, your ovaries stop making estrogen, less food for potential breast cancer. But if you have 60 pounds extra of fat on you, you're still making a lot of estrogen at a time when breast cancers are more likely to develop. So maintaining a healthy weight even into your postmenopausal years is really important to keeping those estrogen levels maybe a little bit lower and avoiding breast cancer. The other thing that increased weight does is it raises your insulin levels. People with diabetes or even pre-diabetes, which is often the result of having excess fat, develop higher body insulin levels. Insulin is a hormone that may help breast cancer grow. So avoiding higher insulin levels from higher sugar levels and avoiding the extra estrogen associated with higher fat are important to prevent breast cancer. Now, beyond that triad of diet, exercise, and weight control, what other environmental factors might be able to prevent breast cancer? And we'll start on the next slide with alcohol. Alcohol is clearly linked to an increased risk of developing breast cancer. When compared with non-drinkers, women who have 2 to 5 drinks a day have about 1.5 times the risk of developing breast cancers of women who don't drink alcohol. Why is this? Well, there's a couple of reasons. First, alcohol raises estrogen levels. We already talked that estrogen is a food for breast cancer. Your body metabolizes alcohol in the liver, and the liver also reduces estrogen levels a little bit. If you drink alcohol, you are raising your estrogen levels because your liver is too busy dealing with the alcohol to take care of the estrogen. Alcohol also reduces a vitamin in your body called folic acid. Folic acid is a vitamin that helps to repair DNA. Now, if you remember back to the beginning of this webinar, it is damage to the DNA which causes cells that would not otherwise grow to start growing again. So any DNA damage increases your risk of breast cancer. And if you reduce your if you reduce your cell's ability to heal their DNA by reducing folic acid, you may be increasing your risk of developing all cancers, including breast cancer. So besides for alcohol, what's another thing that we can do, or rather not do, to prevent ourselves from getting breast cancer? And on the next slide, we will see the next answer, which is smoking. Studies have found that long-term heavy smoking is linked to a higher risk of breast cancer, and that risk is higher in groups such as women who started smoking when they were young. In particular, your risk is significantly higher of developing breast cancer if you start smoking before you have your first child, which unfortunately in your teen years is when most people who become smokers start smoking. I'm not saying it's good to start smoking later in life, but you are certainly doing the most damage if you start smoking at a younger age when your breast still may be developing. So we're trying to keep ourselves healthy by exercising, by eating right, by maintaining a healthy body weight. We're avoiding things such as excess alcohol and smoking. But unfortunately, none of that is a guarantee that you will never develop breast cancer. We are only limiting our risk. Some women will still develop breast cancer even with the best lifestyle habits. What do we do to keep those women, and even some men, from becoming a statistic? And the answer is early detection is the key, and we'll see that on our next slide. You have to be vigilant about breast cancer detection. Women should likely be examining their own breasts and looking on a regular basis in the shower for any new lumps or skin changes, and let your doctor know if you notice any changes in your breast. There have actually, within the last week or so, been some significant changes in the recommended screening. The new recommendations are that women start getting mammograms at age 45, and that screening mammogram take place every other year until approximately age 70. Certainly, if you notice any new changes in your breast, you should be more aggressive and seek a mammogram outside of the normal screening. But it's been found that doing it every other year starting at 45 is probably sufficient for detecting breast cancers early, as breast cancer is, fortunately, a fairly slow-growing cancer. So what are some of the warning signs besides a lump that a woman might notice when examining their own breasts that they should bring to their doctor's attention? Certainly lumps or lumpiness, changes in the skin texture. There's something called peau d'orange, which is French for skin of the orange. Think of the rind of an orange, how it's a little bit puckered, a little bit shiny. That can be a sign of a type of breast cancer called inflammatory breast cancer. So if you notice that your skin is having any of those changes that some people mistake for just a rash or where their bra might be rubbing, if you notice your skin is taking on the texture of an orange rind, that's something to immediately bring to your doctor's attention. Also, unusual discharge from just one nipple, or changes in your nipple shape or indentation. You can see in the picture on the right, retraction of the nipple. If you used to have outies and now you have innies, that's something to bring to the attention of your doctor as well. Unfortunately, you've been diagnosed with breast cancer. You did everything right, you ate right, you exercised, you kept your body weight. What are some of the diagnostic tools that we are going to use to both diagnose and at some point treat breast cancer? Well, we talked about doing the self-breast exam. The second thing on this list is the clinical breast exam. However, in the last week, they've come out and said that the clinical breast exam is fading in usefulness, and there's going to be less attention placed on the clinical breast exam. Mammograms, as we discussed, are good every other year, now they believe starting at age 45. But then there are some higher level tests that we can do. 3D mammograms. These are mammograms that are good especially for younger women with denser breasts because they look from more angles and digitally recreate the breast to find lesions, tumors that might be otherwise missed on the two-dimensional flat plate mammography. And then if there is more concern for breast cancer, either because there is some question on the mammogram or because of a very strong family history, we can do such tests as breast MRIs and breast ultrasounds. And finally, if you think you are at particularly high risk of breast cancer because of a family history, there's genetic testing, which we will get to in a few minutes. So you've been diagnosed with breast cancer. So when doctors talk about breast cancer, we like to talk about receptor positivity. And here you see Pac-Man eating the words because cancers, generally speaking, are hungry. This is where we're going to get back to my mature versus immature monster analogy. You thought I had forgotten about that, hadn't you? Breast cancers are hungry, and the main thing they eat, you may have gathered from the earlier part of this talk, is estrogen. They love to eat estrogen. And if a breast cancer is a more mature breast cancer, and most breast cancers are fairly mature, they are considered to be estrogen receptor, or your doctor will refer to it as ER positive. But there are other things that they like to eat as well that can help them grow. Many breast cancers are also PR positive, which stands for progestin receptor positive. This means that both estrogen and progesterone, which are two hormones that women make on a regular basis as part of normal development, will cause their breast cancers to grow. That's why a lot of the treatment aimed at breast cancer is aimed at blocking estrogen and blocking progesterone, because many tumors are ER positive and PR positive. If you have ER negative and PR negative tumors, that means your tumors are more immature. The more mature the breast cancer is, the more it will look like, under the microscope, normal breast cancer cells, even though it's growing out of control. More immature cancers tend to be more aggressive, like the blob. A vampire will only feed at night and can only suck the blood of a couple of people at a time, while the blob will spread out and just eat anything in its wake. Immature ER negative and PR negative tumors tend to be more disorganized, faster growing, but the good news is that they tend to be more susceptible to things like chemotherapy, while on the other hand, they are less sensitive to the typical treatments such as estrogen blocking treatments and progesterone blocking treatments. So it is very important for you, and especially your doctor, to know if your tumors are ER positive or PR positive, because it will definitely affect what type of chemotherapy and what other treatment options are available to you. There's a third receptor that we look at when we're talking about breast cancer these days. It's called the HER2 receptor. You don't have to remember that. There won't be a test. But HER2 receptors, normal breast cancer cells have HER2 receptors. HER2 receptors are stimulated by growth hormone, which again your body naturally makes to grow. But as your breast cells stop growing, they decrease the number of HER2 receptors that they have so that they stop growing. Some cancer cells increase their number of HER2 receptors on their surface so they are more easily stimulated by your natural growth hormone to grow quicker and out of control. Your body is actually using your own hormones against you, your own growth factor against you, to grow out of control. Again, on one hand, having HER2 positive breast cancer cells is bad because these cells tend to grow more quickly and they tend to be more aggressive. On the other hand, the prognosis is actually better for HER2 positive breast cancers because we've been able to identify this receptor and we've developed specific chemotherapy called Herceptin to target the HER2 receptor molecules. So having a HER2 positive breast cancer on one hand means you might have a faster growing breast cancer, but on the other hand, you do have a potentially more treatable breast cancer. So words that you might see thrown around on the blogs of breast cancer websites include triple negative. What's a triple negative breast cancer? Well, that's a very immature breast cancer that doesn't have ER positive, doesn't have PR positive, and it doesn't have the increased HER2 receptors as well. Again, that's your blob-type breast cancer, very immature, and this will soak up chemotherapy quickly, but we are limited in which types of chemo we can give because we can't use the fact that it has estrogen receptors or progesterone receptors or HER2 positive receptors against it. It all can get very tricky for the oncologist to pick the right combination of drugs. On the other hand, a triple positive, a ER, PR, HER2 positive breast cancer, we have a lot more options to treat, even though those cancers might actually be growing more quickly because they are using your body's own natural hormones as food. What else can we do to prevent breast cancer in ourselves or even in the ones that we love? Some families are prone to breast cancer. Usually in families like this, there will be multiple women who have developed breast cancer, oftentimes premenopausal. Multiple people in one family who have developed breast cancer before going through menopause means there is oftentimes a genetic link in the family, a genetic defect even, that might be causing breast cancer. The first one that we ever identified was called the BRCA gene. The BRCA gene is a gene that is associated with both an increased risk of breast cancer and an increased risk of ovarian cancer. So if you are the daughter of a woman who had breast cancer at age 35, or if you have a sister and an aunt who developed breast cancer in their early 40s, you and your family may benefit from being tested for the BRCA gene. Knowing that you have a BRCA gene gives you more options even before you get breast cancer in terms of surveillance and even treatment so that you can avoid getting breast cancer. Now there are even more genetic tests than just the BRCA. There are actually 2 BRCA genes now, as well as something called a long-chain BRCA, which tests for parts of the BRCA gene without having the entire gene, which is associated with increased breast cancer, but not necessarily ovarian cancer. And recently, again, in just the last few months, a new test has come out for a variety of new genes that may be linked to breast cancer that were previously not detectable by the old BRCA testing itself. So there are now at least 4 new testing protocols for families with a predisposition to breast cancer so that you could protect yourself and keep this in mind if you have children in terms of protecting children who may not even be close to the age that they would develop breast cancer, so that you might be able to set up increased surveillance programs later in their life to catch any potential breast cancers much earlier. So in conclusion, don't accept breast cancer as inevitable. There's a lot that you can do. There are lifestyle changes that you can make. There are environmental factors such as smoking and alcohol to avoid. There's early detection so that should you get breast cancer, it can be found early and be treated more quickly. There's a knowledge base. We talked about the estrogen receptors and the HER2 receptors, so that when you're being treated for breast cancer, you can be a more informed consumer. And there's genetic testing so that you can know in advance if you or your loved ones might be at increased risk, so you can be more proactive about breast cancer in you and your family. Next, how can Activ Doctors Online help you become a breast cancer survivor, or maybe even never get breast cancer in the first place? First, with Activ Doctors Online's personal health records, you will have access to all of your records at all times. With the electronic medical records that most have, each doctor keeps their own medical records. And although you should be able to have access to all of them through individual doctors, web portals to their electronic medical records, you never will have all of your records in one place. The doctor's electronic health records don't talk to each other. You need some way to keep all of that information under your control. You need to be an active consumer. And with our personal health record, Activ Doctors will gather all of your information from all of your doctors and put it online under your control. So if, for instance, you move or are out of the country or change doctors, you won't be at risk of losing any of your medical records. Should you have had a biopsy before, those biopsy results will always be with you. If you've had mammograms before, those mammograms will follow you even if you move across the country or across the world, so that your doctors will always be able to compare those, which can be life-changing in terms of making sure that you haven't developed a new change on your mammogram. Next, with our online second medical opinions, if you do develop breast cancer or any other serious condition, our expert specialists from around the country and around the world are available to do an electronic second opinion to give you the latest information. There have been a lot of changes in breast cancer. The HER2 gene is relatively new itself. And again, there are a lot of different genetic testing. We could help muddle through some of that information to give you the best advice on what kind of treatments you need and what you can do to protect your family going forward. And finally, with our e-consultation, if your doctor is a member of Activ Doctors Online, we can allow you to help communicate with your doctors through our web portal, so that if you are getting chemotherapy and don't feel up to actually getting into the doctor's office, maybe you can communicate with your doctor electronically to improve your overall health and well-being. With that, I'm going to turn it back over to Caitlin to tell you how you can sign up for Activ Doctors Online's unique web-based services and how you can start your free trial.
Thank you, Dr. Zahalsky. At Activ Doctors Online, our vision is to educate, engage, and empower our members to take control of their health destiny, to save time, money, and even lives. We invite you to start a 30-day free trial of Activ Doctors Online. Simply head over to our website, www.activdoctorsonline.com, and click Get Started. If you would like more information or would like to schedule a demonstration of our unique health platform, please feel free to contact Dr. Zahalsky or myself directly via email. You can also reach us on social media. Find us on Twitter at Activ Doctors and on Facebook and LinkedIn at Activ Doctors Online. We hope you enjoyed today's presentation, and we invite you to join us next month for another informative health webinar.